Hello and welcome to Beyond the Mirror podcast. I have a very interesting guest, a plastic surgeon, Dr. Apostolis, but he's actually one of the few people who offer 360 approach to his patients, not only focusing on surgery, but on wellness, holistic, and most importantly, skin health. Welcome, Apostolis. Thank you very much. Apostolis, can you please tell us why you chose this path, plastic surgery, and then you diversify into aesthetic? You're offering a full package for your patients. So what was the motivation factor behind this choice?
Absolutely. First of all, thank you very much for having me here. It's a great honor. I mean, we know each other for quite a while now, and I'm a big fan of your work.
Thank you.
Of the clinic and of the podcast, obviously. So it means a lot to me. Thank you very much. So let's start with plastic surgery first, because, that's my everyday work and life at the moment. I've always wanted to become a doctor, and I know it sounds a little bit funny, but I always wanted to become a plastic surgeon. That started from the age of probably 13, 14 years old, playing with friends, and had accidents, and they were going to A&E, and I had stitches and a little bit of small amount of reconstruction done. And I was fascinated by that. And then in school, when we went a little bit deeper into biology, understanding more the human body, the anatomy, and the science behind wound healing, I was amazed. I was fascinated. So I knew from day one in the medical school, which was in 2000, many years ago, that everybody was asking, what do you want to do? We don't know. And I wanted to become a plastic surgeon. And then obviously, when I went into plastic surgery, a lot of things that I was thinking as a young boy was definitely confirmed, and much more than I knew in the way. And then obviously a lot of other things that I knew or I didn't know came along as well. So I got now to have a full understanding of plastic surgery. But before plastic surgery and sort of the training in plastic surgery came in my life, that's a very interesting part. Many countries in Europe, you know that, it's only the dermatologists and plastic surgeons are allowed to do aesthetics. So I had a small gap in my training, finishing university. Then I did 1 year in army, which is mandatory in Greece as our service. And then I had a bit of a year gap before I start my proper surgical training. And at the time in Greece, in Athens, one of the biggest, I don't want to say the biggest, was probably one of the biggest, and a very post-clinic, fantastic place to work, got me in just to, spend a year with them, get into aesthetics and all that. So that's how I started. So my aesthetics training started before my plastic surgery training. And at the time, it was Botox and fillers and lasers, a lot of technology. And I fell in love with that, with this part of, plastic surgery, the aesthetic medicine. Even back in the time, I was a lot into regenerative medicine as well. I was trained very early on in some longevity protocols with a popular Norwegian doctor called Lindbergh. So I was doing ketotic diet training back then, and then obviously the injectable side and the laser side. And that lasted for at least 5-6 years while I was doing my surgical training. I came in the UK, a small gap, devoted fully on my plastic surgery training, and then I returned back into aesthetics in 2017. So obviously now the last few years, I combine both, as you know very well, it's a holistic approach. Some people need that, some people need the other.
Well, and I think that would make it quite unique, this synergy, because I think a lot of plastic surgeons, they just focus on surgery and they're not interested in skin or regenerative medicine. I remember you were the one who actually mentioned to me quite a few years ago about polynucleotides. So now it's just absolutely booming in the UK.
Absolutely.
So I think it's very important to have this 360 approach. That is exactly why I wanted to find out more about your career, and I'm sure that all the advice that you will give will be so valuable for people who are watching.
Absolutely. Yeah.
And how did you start your independent practice? Because a lot of surgeons, I don't know how it's in Greece, but in the UK, have a career path when they go into NHS. So taking a risk, leaving security of the guaranteed job and starting your own business, how did it feel?
So yeah, I mean, the same thing happened for me as well. I've invested since the day I came in the UK, was 2012. 10 years straight into the NHS. I did all my training. I did master's training in reconstructive microsurgery. At some point, I was just purely focused on skin cancer, melanoma management, and doing reconstruction after mastectomies with, for breast reconstruction. And then after the pandemic, at some point, I was feeling that the situation is not really what I wanted to do. I mean, parallel to that, I've always been close to my aesthetic, small pathway in a small clinic, controlling what I do, but my main focus was the NHS. So I came to the point that said, enough is enough. I cannot do that anymore. I need to focus on myself, and I want to do what I want to do really in my career, in my life. It was a tough decision to take, but I think I had all the fuel behind. I had a vision behind it, and it is always a bit of a struggle in the beginning because it's not just the financial stability. I mean, the NHS gives you a salary, and many people are happy with that, and they can make their life on that. But then coming off the NHS, it's not just the stress of, I need clients now, I need patients, I need to get the money, but also you have to run a business. So suddenly, and in a very short time, you understand, I'm not expert in business. I don't understand everything about finance. I'm not an expert in, media or doing my website or doing my marketing. So there's so many parameters that you have suddenly,
and responsibility, I presume, for other people who are working for you.
Of course, absolutely. And then you have you're responsible for your team as well, and who you coming in your team, and you're responsible for everybody working with you. So that was the main stress. But I feel for anybody who's starting now, if you feel, and if you stay loyal to your goal, and you're consistent, and you persevere, success will come for sure. It just needs a lot of hard work.
And how was your family, friends? Was they supportive? Did you have their support behind you?
With family and friends, they're always there for you, and they will obviously, they know me very well. They knew exactly what I wanted to achieve and what I wanted to do, so they've always been supportive in regards of that. I had the luck, they're always telling me how you're very good, you have to try that, you have to do that, you have to go in private and all that. But there's always, I felt there's always a bit of skepticism when you say people, he's got a young family, he's going to, financial and all that. So I think this skepticism was giving me always a little bit of fuel to push myself, to prove them that, yes, you believe in me, but yes, I can do it.
So, and I also feel, I came from another country to the UK, so did you. I feel it is UK is very open and I think very diverse, which is great, but I think it's always harder to prove yourself when you're moving from a different culture, different country, different language. Did you find any obstacles in that way?
Yeah, 100%. The same applies to me, obviously, and I have probably felt that every step in the way. When you start as a younger, sort of, if you want junior doctor in the NHS, then you become a more senior registrar, then you want to step up in a consultant role. I have always been feeling that I have, to double the effort. The same always applies when you come out in the private practice as well. There's, obviously British colleagues are well established, and people know them from, for many years. I kind of felt that, that is the situation with me. So I had to be clever and quick, opening many doors, getting my name out, and, try. But yes, I totally, felt that over the last 10 years for sure.
Well, I think in a positive way, I think it gives you probably even greater sense of fulfillment because you're not only achieving your goals, but you're achieving your goals in a different country. I think when you're doing it in your own country, it's great, but you are, you are home. But when you're somewhere else, I think it gives you better sense of fulfillment.
True, agreed, yeah. 100%.
So Apostolis, when you were starting your business, how many, you mentioned that you worked hard and you followed your dreams, but what sacrifice were you putting in? How many hours you were putting in to get where you are today?
Unlimited hours, because you have to do the work, then you have to do the actual physical work. Myself, even as a surgeon or when I do aesthetics, I still up to date, I have to operate on my patients. There's a lot of time behind operation that you have to consult, you have to see them before and after. But forget the clinical, there's a lot of work being behind the scenes, obviously with the marketing and the websites and creating opportunities and getting the leads in. I think it never stops. I mean, in here, it never stops. It goes on and on and on. So I would definitely be doing, sort of Monday to Friday, starting at 7, 8 o'clock in the morning, going to 8 p.m. Weekends, again, there will be, events, there will be training, there will be courses. So there is a lot of sacrifice, and I don't feel that even at this stage where I am now, this has finished. There's always new opportunities. You're always exploring new things. So I'm still going through that phase that there's a bit of sacrifice.
You're still putting same amount of hours, or that's balanced now?
Things change in terms of quality and quantity. Definitely, I don't need, because after a few years, there is a little bit of background work done, so everything works in our favor. I still try to operate as much as possible, but at least I reduce a little bit the amount of effort around the rest, which would be obviously the social media and the marketing and then business side. Yeah.
And you said that you still like to operate, which leads me to ask you my next question. So what is your favorite surgical as well as non-surgical treatment?
Okay, that's a tough one. I will purely talk about cosmetic surgery, okay? Because over the last 3 years, that's what I mainly do. I've left NHS now in the reconstructions. I really, really love the combination of what we call the mummy makeover. Where I see a lot of ladies, the age of 40 maybe, they had kids and changes coming with pregnancy. And this is a combination surgery where we obviously target the area around the abdomen, unwanted fat, and the laxity of the skin. Most likely will be a combination of abdominoplasty, tummy tuck, with liposuction, and then that's all combined with some breast surgery, to either uplift or reduce the amount of the breast. That's called as well-known mummy makeover. So body contouring and this kind of combination operations are my preference. Without not liking the other stuff that I do. In London I do a lot of gynecomastia surgery. I love it as well. Because something that I haven't been doing in the NHS, and I came now to meet a lot of male patients that they have what called the man boobs. And you cannot imagine how much this affects their confidence, and it gives me such a massive sort of pleasure to see them changing, life-changing results, and how much they enjoy that. So I would say, definitely that's my area in terms of breast and abdomen. That would be my always number one choice for cosmetic surgery.
And for non-surgical treatments?
I've been doing non-surgical for the last 16 years, so as you can imagine, a lot of things have changed. So I will tell you my current thing. I would probably say it's more the regenerative stuff. I really, really enjoy the transformation that we can achieve with regenerative medicine at the moment, combination of exosome with probably RF microneedling and polynucleotides, what you can achieve in terms of long-term anti-aging effect.
Amazing. Regenerative medicine, I think, is the future. But what is, in your opinion, do you see an end in sight of medical aesthetics, or do you think it will be just a change of what's popular, what's not?
Definitely, we're not coming to end. I think it will never end, okay? Because I'm not old in that. I'm doing that for 16 years, and I can see what's happening over the years is that aesthetic medicine is adapting to society, is adapting to technology, to science, and you can see that not only with the nucleotides, which we say it's the future, but actually nucleotides have been there for many years, as you know very well. How laser technology is evolving, and now obviously we have the stem cells and the growth factors. What I actually see is how people and society perceives aesthetic medicine. People coming to us nowadays, we've gone past the period of making big lips and big cheeks and big chins and all that, and people ask for natural results and sharp results, wanting a more holistic approach which will combine our skills and obviously supplementation, putting them together to achieve anti-aging, proper anti-aging results. So definitely not coming to an end. Aesthetic medicine will be there for a very long time, adapting what people need. And also, as a surgeon, I'm very, very happy to see how now aesthetic, non-surgical stuff come and join the surgical stuff, because we use and we bring so many skills from the aesthetic medicine in order to prime and prepare the skin for some of the surgery that we do. So we're far from the end.
Well, and you mentioned big cheeks and big lips. I think you are very far away. We both never been one of those practitioners who just following the trend. I think the trend is always natural, beautiful, individuality as well.
Exactly.
And when you mention about mommy makeover, it kind of brought to my mind the next question. A lot of patients trying to save money and traveling abroad, trying to have a better deal. So to specifically this kind of surgeries, what is your opinion on that, and what advice would you give? Is it a good idea, or it's better not to compromise?
I mean, thanks for asking that. That's a great question, because we, obviously, the last few months, so much bad news. We heard people have died, but it's not just that. We have people coming back, and we're talking about hundreds of people having complications and hundreds of people looking for revisions. Okay, so medical tourism is not something new, for sure. I mean, even when I was in the 90s and 2000s, people would go abroad to have surgery. Obviously, now with the social media and different marketing, they attract even more people outside, and with the cost of surgery in the UK being a little bit higher, cost is an important thing. So what I say to people, always asking me in the clinic as well, is number one, that medical tourism is not vacation, it's real surgery, and they have to take it really seriously. I know people over there advertise it, or come around, sun, have a little bit of vacation, then we'll do a little bit of surgery. It's not vacation. And secondly, they should never put the cost above their own safety. The specific things they need to look for, there's obviously, don't take me wrong, fantastic surgeons in Greece, in Turkey, in many different places, but they have to properly research the surgeon's credentials, where they're coming from, testimonials, before, afters, but that's not enough. They need always to be looking the place, the hospital, the facilities, who's going to be the anesthetist, what's the experience around that. People also need to be prepared and know what is going to happen if something bad happens, over there. What's the policy around return back in theatre and sorting out problems. People sometimes don't really realize that having also a long flight across, when you have all binders and drains and all that, it makes you prone for clots in your legs, in your lungs, as we call DVT and PE. And then people arrive back in the UK, and then the problems will start. We know as surgeons, most of the problems will happen after 1 week, when everything is healing or non-healing and then coming apart.
Or sometimes later.
Exactly. 3 weeks, 4 weeks, and so goes on. Who's going to see them at this stage? What's going to happen if they need a revision? So all this is very, very important, and I don't think that people think seriously about that. So that's, I think, the 3-4 key points they have to check before they commit to going abroad. But the key message here is cost never is more important than our safety.
I think you brought a great points and gave fantastic advice, but also one thing which I personally see there as well, and from dental point of view, because I'm a dentist by background, and a lot of people traveling for dental treatments as well as cosmetic surgery. I believe that with anything medically related, either you're just general physician, plastic surgeon, dentist, it's continuity of care. If patients see a different practitioner every time, I think he will get 10 different opinions and 10 different advices, and not necessarily that each of them could be right, but it's only one will be right for this particular patient. And if you're jumping from one practitioner done for you a surgery and another doing revision, and the third practitioner follow this up, I think it's a little bit of miscommunication. It's always better to have a continued care, and I think that is not something that medical tourism can bring or offer.
I'm sure it's very, very difficult
to,
for us seeing here patients, they've been abroad, to collaborate with a facility there to pass all the information we need. I see people more or less every day, they've been abroad and they come back for revisions, and I genuinely want to help them. I don't want to, because I know other colleagues, they say, you came from Turkey, I'm not interested, I'm really sorry. I want to help them because I understand the frustration and how they feel. But as surgeons, we need to understand what has happened in that place. We need medical notes, we need to surgical notes, understand the steps of what's going on. It's impossible to get that. And that makes our job even more difficult, and there is again added risk in that. So it's all these things that people have to take definitely into account. Yeah.
Oh, absolutely. But also, I think a lot of people see aesthetic and cosmetic surgery as very lucrative industry. And I know that a lot of medical professionals, they entering the industry and they want to make a career path from that. What is your advice will be to the practitioner who would like to start their career in medical aesthetic and looking to start their journey, what they should be looking at, what the trainings they need to underwent? What is your opinion looking from experience of all those years?
Yeah, another great question, and you're actually right. I'm sure that there's a lot of practitioners out there, different doctors, nurses. They might see people that are well established in the UK, like yourself and other people, that colleagues that we talk, and they might think that I won't do that. It's easy as that. So there's definitely a lot of space for all of us, and we definitely need good practitioners in the UK. The single one thing that I say to everybody, when we're doing this kind of talks, is that they need to be good. I mean, there's a lot of other stuff that you can improve, but you have to be really good and passionate at what you do. That means a lot of hard work, a lot of training. You have to invest properly into training, and God bless, we have so much training going in the UK. And you have to take it a step at a time approach in order to get there. I think money should never be the focus, should never be the end goal, because this can be associated with catastrophic results. So first of all, they have to build very strong clinical skills, and not only doing something, but knowing how to say no, how to treat a complication, how to look after patients. Okay, that's the first thing, that they will start bringing patients around you. And then obviously it's a lot of different small things, all of this very well. You start with 10, 20 clients, and you have to keep them around you. You have to improve your word of mouth sort of reputation. You have to build your rapport. Once you own your clinic, hopefully then there's a lot of work that needs to be done in terms of your social presence, your marketing, your media, your social image profile. This has to be looked after. There is many ways for these new practitioners to increase the clientele, obviously by doing different marketing and promotions and very specific advertisements. Parallel to that, people will need to start improving their collaboration and networking with people. But then I'm coming again back what I said in the beginning. It's all about patient care, about quality care. And if they bring that from the beginning into their practice, they can only increase the numbers, because people will be talking about that. So sooner or later it will happen. But they have to be very patient, consistent, and have strong guts.
Well, there is no an easy answer. I think everything that is worth something at the end require a lot of effort and hard work. And when you're passionate about it, I think it makes this path much more enjoyable and easy for you.
Yeah, absolutely. But we have sometimes, as ourselves being here for more years, people starting now, we have to be clear, there's not an easy way. It's not from A to B, and they go in, they bring a little bit of money with marketing, and they will become successful. People need to understand that it's much harder to keep clients always happy, and how much effort we all put in to get at some point where we are.
And I do still believe in a little bit old-fashioned marketing, despite we do a lot of marketing, modern marketing, but the best one, I think, it's patient referral and recommendation. I think that is what absolutely non-negotiable. I think that would bring the best patients to your clinic.
Absolutely. It's always better you start with 5 clients, and then next month you have 10, and so goes on, rather than you just do a massive marketing campaign and you come in an uncontrolled situation that you cannot deal with it. Absolutely.
Well, thank you for so many valuable advice, Apostolis. And one thing that I also want to ask you is, there is anything you wished you learned earlier in your professional career? It could be not necessarily from medical point of view, maybe from business point of view.
Yeah, you just actually said what I've been thinking. Just to make a small joke, if I knew that it's going to be so hard, I might have chosen something different, with all the respect, obviously, to all the other professions. Yes, I think as plastic surgeons, people sometimes don't really realize that, we go to medical uni, 6 years, then we start our training. My training got 13 years. So I started at 2000, I became a GMC registered consultant plastic surgeon in 2020. Yeah, that's 20 years of training, which is increasing my skills, increasing my numbers, pushing myself, do more and more and more. And then the moment you come out of it and you become private consultant or you have your own business, you realize you know nothing about business. You know nothing about finance, about running a team around you, about marketing, about media, you have no idea, because nobody will teach us in the way how to do all that. And then some of us might have the skill and they're much quicker without. Some people will struggle. So I think that's the only thing I would like to have known beforehand during the way, attended maybe business courses, or if there's something like that in the medical uni, or as we get our medical training, to have some part of that in our training, I would have felt much better coming out of the NHS and feeling stronger about business and business management, running the business.
So maybe you should add a short business course to a medical school. And Apostolos, I think this came out a few times during your conversation, that you said that we improve patient life, we help them to be more confident. Which probably I already know the answer to my next question, but I still would like to ask you that. Do you believe that correctly performed plastic surgery or non-surgical treatment have impact on the patients that goes much far beyond their appearance?
I mean, 100%. I cannot stress that enough. Let's not talk about cosmetic surgery because that is obvious. I mean, I still do some of life-changing operations for men, for female. So there's no discussion about that, okay? But let's talk a little bit about the medical aesthetics now, because every day, yourself, you see that a lot. You might just be injecting 0.1 ml on someone's tiny bump on the nose, and you do it perfect, and you say, okay, yeah, that's fine, now it's straight. And the amount of confidence that these people will be having, and the improvement in the self-esteem, and how they see themselves beyond the mirror, you cannot. It's unbelievable. We obviously always have to focus on nicely executed procedures, Legiatis techniques. I love that approach, obviously, as you know, but sometimes we don't value enough the impact that a small change can have on patients' lives. And I think we live into this era now of self-confidence and empowerment. So you see that we make small changes, but then it definitely goes beyond the mirror, how much they improve their life. Yeah, 100%.
Well, thank you very much, Apostolos. It has been a great pleasure. And just to finish our podcast, can you please tell people where they can find more information about you, or if someone wants to book a consultation or training with you, how they can reach you?
Thank you very much. Again, it's been a great talk. I am the medical director and lead surgeon for UK Skin. UK Skin is the leading group of cosmetic surgery. At the moment, we have a clinic in London, in Birmingham. We're opening out a new one in Manchester. So just reach out at UK Skin, and I will be more than happy to see anybody and discuss any concerns. In terms now of training, as you know very well, I still do a little bit of work with Sinclair and Filmed, and speak and train for these people. So again, anybody interested in this kind of things, they know where to find me.
Thank you very much.
Thank you very much as well.